Hello everybody, welcome back to the TMI Club. Today we are talking about PCOS with Dr. Jess. Dr. Jess, would you like to introduce yourself to the folk at home that may not know who you are?
Yes, so hi everybody, I am Dr. Jess. I am a naturopathic doctor in Toronto. I focus my practice on all things reproductive health, so everything from periods to vaginal health, libido, and everything in between. So yeah, I'm just so happy to be here.
Yeah, I'd love to know, what is PCOS for those that don't know, and why did you get into it?
Okay, so PCOS is Polycystic Ovary Syndrome. So first and foremost, it's not the greatest name. It is really, I don't know, it's a bit confusing for folks because when you hear it, you're thinking cysts on my ovaries. And that's one of the, I would say, the least accurate way of diagnosing. First of all, it's not cysts, it's actually follicles. We'll get into that in a little bit. So there's a bit of a misnomer there. The other part of it is it's just a combination of hormonal and metabolic issues. So we'll talk about the hormones in a bit, but there's definitely a hormonal piece. It's gonna affect your periods. It can affect your metabolism, your energy, and those types of things. But the way it's diagnosed and all of those pieces we'll kind of dive into shortly. But yeah, it's a very complex condition. It's something that, you know, if we just limit and simplify it to hormones, we're missing a whole big part of it that needs to be addressed.
And what made you want to get into helping folk with PCOS? So
I actually have PCOS, so that was kind of the start of it. And I had a really tough journey getting my own diagnosis. I also had a tough journey getting any type of treatment. So a big part for me was they basically told me to just wait. We don't really know what it is. Or you could take the pill and see what happens type thing. And for me, that wasn't enough. I wanted to understand what was going on in my body. And for me, I was really privileged because in my family, we really already were exposed to naturopathic medicine, exposed to traditional Chinese medicine, which a lot of people aren't. So a lot of people don't even know what I do, and so it takes them years to find other answers. For me, I was grateful that I had the opportunity. Once I got symptoms, I went straight to an ND, and I saw the power of holistic medicine, and then it just drove me to start getting into this realm. So
awesome. Well, thank you for helping the community with your own personal experience. I'm sure it gives a lot of patients comfort.
And a little bit of hope, knowing that there's like direction and place for them to be.
Absolutely. So I know you mentioned that it's a hormonal disorder, but there's a big aspect outside of hormones. Could you go a bit more into that?
So when it comes to the root cause of PCOS, I wouldn't say hormones are the root cause of PCOS. There's something that causes a dysfunction in the hormones. And a big part that probably a lot of listeners have heard about is something called insulin resistance. So that is a huge part, and that's where our cells become resistant to a hormone called insulin. And it is something that basically impacts our blood sugar regulation, impacts our metabolism, and it actually feeds into a ton of pathways that leads to issues with our hormones, leads to things like acne, can lead to fertility issues. So we got to look at the root cause. The other part of it is inflammation. That's another big one, and we know that that is a root cause of so many other conditions, not just related to reproductive health. And then other pieces like gut health, nutrient deficiencies, all these different things that are associated with PCOS that really impact the person's symptoms. So it's not just one thing, it's so many things combined.
It sounds very intersected. And you have to consider the bigger picture versus like just your hormones or just your gut health. So what are some symptoms that people should look out for, and if they do experience these things, they should go seek help?
Okay, so there's a few. So if we talk about the first one being hyperandrogenism, meaning high levels of things like testosterone or just symptoms of that, that can show up as acne. Typically with PCOS type acne, it oftentimes is inflammatory. So it could be cystic, it could be painful, red. It typically is located on the cheeks, the jawline. It could be located other places. There are variations. So another caveat with PCOS is it is a syndrome, which means that it shows up differently from person to person. So that's just something to keep in mind. The other piece is hair loss. So it could be actual hair loss, significant hair loss. It could be thinning. It's typically located in the front region of the hairline, maybe the temples, even the top of the head. Other parts are insulin resistance symptoms. So that could be things like sugar cravings, weight loss resistance, where you're trying to work out and just nothing's budging. That can be a part of it as well. And then some associated symptoms, things like low mood, depression, anxiety are associated with PCOS. There's also things like iron deficiency, anemia, PMS. So a whole host of things from a mental emotional piece that can definitely tie in there. And then the other piece is excess hair growth. on the face and body. And so that one I like to caveat that for some people this is a symptom that they want to get rid of, and for others this is not a symptom that they really care to get rid of. But it is something that could be a sign that we need to look deeper. And then of course with our menses, or our periods, we need to talk about that. So that is either irregular, so either they're over 35 days between day one of the cycle, from your first day of your cycle to day one of the next, over 35 days, or you're having less than 8 cycles per year. So even though you're bleeding, maybe you're having a bleed every 40 days, it might still be PCOS. We need to look a little bit deeper. For some people, they don't have a period at all. So it really depends on the person there. And that's why it takes a bit more than just, you know, we have situations where patients don't realize that they can fall in 4 different categories when it comes to PCOS. It's not as clear cut in terms of diagnosis.
So when you go into a clinician like yourself, and someone comes in and lists different types of symptoms, where's the first place that you start?
Yeah, so I usually start with the Rotterdam criteria. It's like the most well-known criteria to diagnose PCOS. It requires 2 out of 3. So the first one is the period part of it. So either it's anovulation, so you might be bleeding, but you're not having ovulation, so you're not actually releasing an egg every month. We have oligomenorrhea, which means that you might have longer cycles. It could be over 35 days or less than 8 cycles per year. Or you're amenorrheic, meaning you're not having any bleeds. So that's number 1. The second criteria is hyperandrogenism, or clinical signs of androgenism. So to make that clear, it could be things like testosterone on blood work, DHEAS, androstenedione. There's a whole host of androgens that can be elevated, but they actually might not be elevated, and we might just have clinical symptoms. So that might be the acne, the hair loss, the hair growth on the face and body. And then the last one is the PCOS appearance on ultrasound. So this is where it gets a bit tricky. We hear cysts, but it's actually not cysts. Ovarian cysts are something completely separate, and we're actually looking for follicles on the ovary. So a polycystic ovarian appearance on ultrasound would require typically a transvaginal ultrasound, and then they would see either 12 or more little tiny follicles on an ovary, or the size of the ovaries are too big. So you just need 2 of those 3. And you can have all 3, but most people have 2. Typically.
So it sounds like, especially with the ultrasound as well, you can't get this diagnosis all in one visit, or can you?
Technically, you could. Because if you came into me and let's say you had irregular periods and you had acne, you would fit the criteria. But for me, as an ND, like my biggest thing is I need to know that we're actually treating the right thing. So I have patients who come in, you know, I'm pretty sure I have PCOS. I read it somewhere. I heard it here. My doctor told me I have it. And I'm like, that's great that you have a diagnosis. Let's start working with that. However, because it's a syndrome, we need to look at the thyroid. We need to look at other things that could be going on in terms of prolactin and other hormones that could be impacting your symptoms, instead of just narrowly focusing on one thing, because there's so many things that can either coexist or actually mimic symptoms of PCOS. So that's another piece. It's like if you come in with a diagnosis, you might not have it, you might have it, but you might also have other things. It's really just trying to combine that all together.
So I'd love to know, we talked a little about the physical and we touched briefly on the mental and the emotional aspect. How does it affect someone mentally and emotionally, lifestyle-wise, through relationships, self-esteem?
Yes, I see it a lot in practice. I think there's, you know, we see the coexistence with anxiety and depression. And then when we look at the why, you have to think that a lot of people coming in with PCOS, they have waited years for a diagnosis. They have been sent to multiple specialists who maybe minimize their condition or who have told them that their symptoms are fine, that there are no options. People have been told lies that they cannot get pregnant, and just so many different things that are could be misinformation that have created a lot of stress. And then a lot of issues with, you know, self-blame and self-esteem that can happen there as well. And then we think about the resources perspective. A lot of people don't necessarily feel fully supported. Or they feel very confused because we have access to so much information on the web and on socials that they can come very overwhelmed. And then I think the last piece is just the whole idea of like, what does this mean for me? So just that idea, especially with fertility, it can be a really emotional conversation. I always have to tell them that, you know, PCOS is not an infertility sentence. It does not mean you're going to have problems conceiving. It could happen, but we just need to figure out what's going on so that we can treat that and, if necessary, look at options. But yeah, I think there's definitely a lot of emotions that can come up. I think the self-esteem piece, you know, folks who have acne can be really challenging. People who are having hair loss, you know, a lot of people identify with their hair. Their confidence is through their hair, and then all of a sudden something happens and they start losing their hair. It can be really detrimental on their self-esteem. So I think there's a bunch of pieces there that is a combination between their journey with the diagnosis, their lack of support, and then what their actual symptoms and how they present in the world and how that can affect them.
What would be a piece of advice you would give someone who is struggling with that self-esteem and they perhaps are in a relationship where they feel they aren't fully supported?
Yeah, I think a big thing would be like, you're not alone. Like this condition is so common, and from firsthand experience, it's about finding not just providers and healthcare providers that are going to root for you and advocate for you and support you, but also having people around you that are also going to do that. If you have a partner or friends or parents that are not necessarily listening to you and actually validating your experience, then that's a whole other conversation that needs to be had, but the support piece is essential. And I would say that applies to anyone dealing with any type of reproductive health concern, whether it's endo, fibroids, vaginal health issues. Like, you need to find the support in both the medical system, outside of the medical system, and within your support system at home.
You were mentioning it was common. It is common to have PCOS. How common is it? Is there a stat out there?
Yes, I believe it's at 20%, but I think it's underreported
as well.
Yeah, I think there's a mix of what we have as underdiagnosed and a little bit of overdiagnosis when it comes to PCOS. We have the people who are underdiagnosed who are not necessarily or being dismissed because back in the day, PCOS was typically seen in overweight folks. And then the overdiagnosis is really the people who actually have completely different conditions. That the doctor just looks at two things and says you have PCOS and then treats it that way. So I think it's kind of a mix, and I don't think stats in the reproductive health world is all that accurate. To be honest. Yeah, but I'm seeing it all the time. I would say I have at least 7 calls a week that is just PCOS
related.
At least,
So what would be the next steps if someone called you and they wanted to come see you and you mentioned to them that, you're not alone, here are all the options? Could you touch a little bit more about how do you provide that hope? Is it, here's a list of things that we can do for you, or does it go deeper into diagnosis?
Yeah, it's kind of a combination. So because I'm a naturopathic doctor, we have both biomedical and naturopathic training in terms of things like herbal medicine and supplementation and looking at things like acupuncture and traditional Chinese medicine. So in my first visit with patients, most of the time we do a free discovery call, and I do 15 minutes with them to get to know them and make sure it's a good fit. Because for me, I want you to be set up with the right practitioner who's going to serve you and be able to support you in the way that you need. So my practice is only reproductive health. That's all I see. And so if I feel like it's a good fit, we talk through not just your symptoms, but your experience with getting here to my office. Because 9 times out of 10, most people aren't seeking naturopathic care right away. I would love for people to come to me like early on when they're just starting to deal with their symptoms. But typically, it is something that people are exploring later in life. And so with that in mind, there's a lot of emotion. There's a lot of emotion, a lot of pain, a lot of, just tears that actually end up coming up because of how much pain people are going through. So with a combination of that, we talk about that in my approach. And really in naturopathic medicine, there's so much time that we can use to dig deep. So we have up to 2-hour appointments that can really dig deep into what's going on and provide the support. And so treatments can range anything from lifestyle, nutrition, supplements, herbs. It really depends on the person. It could be counseling, it could be really a whole host of things. And a lot of things are collaboration. So I work closely with medical doctors. I work closely with physiotherapists, pelvic physios, huge fertility doctors, those types of things, just to make sure it's a well-rounded and collaborative approach for my patients.
So I love what you said, there's different options.
Totally.
When it comes to treatment. Options. There's not one path for treating PCOS.
And I think with that, it's when you go online, again, we talked about this earlier, but we have access to a lot more information than we did 5-10 years ago. And so it's amazing. People feel empowered. People are learning more about their bodies. Our sex education sucked. I think we can all agree. So with that in mind, it's nice to have a little bit more access to free-flowing information. The caveat to that is that there is a lot of people talking about certain supplements and herbs that you should take or certain diets you should be on. And the reality is that there is research to support so many different diets, and it needs to be the diet that's right for you. Right? It needs to be the supplement and the herb that's right for you, because the problem is people are coming in on a bunch of things that are all interacting or that are all not serving their purpose based on their lab work, or their symptoms could be making things worse. So that's just something that I always say, just as a caveat. There are so many options that you need to figure out what's right for you.
So if anything, for those that feel hopeless, in fact, there happens to be so many options that may work for you, but you have to come and work with a specialist that can do the tests for you, so you can learn a custom plan that is to your body and where you're at.
Totally. Yeah. And someone that's actually taking into consideration, are you on meds?
Yeah.
What's your history? Any history of disordered eating, that comes up a lot with PCOS. So there's a lot of different things that need to be tied together to create, like you said, an individualized custom plan. Yeah.
What about hormone pills? Is there any connection there? Because I know you said hormone isn't the full picture when it comes to PCOS.
Hormone pills meaning treatments?
Yes, treatments, birth control.
Yeah. So with birth control, that's like the main tool that the conventional system usually uses. Typically, you might hear anything like watch and wait, the birth control pill, or some sort of hormonal contraceptive, and metformin. Spironolactone also has been coming on the up, where we're seeing that more and more in practice.
Yeah.
So with the hormonal birth control pill, what it's doing is suppressing your hormones.
Yes.
And it's causing you to stop ovulating. Typically, the IUD is the only one that may not cause a lack of ovulation, but the other ones do. And what that's going to do is it's just going to shut off the system. Now, I know many patients that just want to be on it because their acne is just so significant, or their period pain, if they have endo, is just so significant, and it definitely helps to suppress the symptoms 100%. So it's about supporting that. However, there's a lack of informed consent that's happening, and then people come off the pill and expect that their periods are going to be regular and that their acne is going to be gone, and that's not always the case, because what we've done for years is just suppress and suppress and suppress, and then you come off and we're like, now we need to deal with it. And so I think there's a lack of expectations that are set. I think birth control can be effective if we're using it for symptom management, but not necessarily treating the disease. Like when we're treating PCOS, the pill is not treating that, it is just suppressing what's going on.
So do you find in the work that you do, it's more about the root cause?
Yes, for long-term effective, sustainable change, it's about the root cause. It's about the diet changes and lifestyle changes and getting movement and working on the insulin resistance and the inflammation pieces and looking at all of that, because that is what's going to treat this condition. It is not curable. But it is something that can actually create long-term changes, and that's really the goal. I don't want people to have to stay on supplements for their whole life. We want to make it so that it's sustainable for you. Do you have any tips for anyone that may have PCOS listening in on this and they haven't seen their practitioner yet? Yeah, I would say, number one, it can be very tiring to have to advocate for yourself, but it is a really big part that we play in our own health journey. I think, especially if reaching out to other practitioners like myself or holistic healthcare providers might not be accessible to you, because that's a very real aspect of this. It's about finding the information and then going and advocating for yourself, for the right testing, for the right treatments, for the right options. I think talking to practitioners and getting yourself a team that is willing to do the tests and advocate for you and really listen to you is going to be really, really important. And then from my perspective, if you do have access to naturopathic doctors, finding someone who's actually focused in this area of health, whether it's general reproductive health or PCOS specifically, and start talking to them. And be open to the fact that there might be things that certain tests they might have to do, certain treatments that they might have to do, but it should always be aligned with your goals, and it should always be aligned with what you need in that moment, because I think our health is so fluid. It's changing throughout our life, our needs are different, and so it's really important to keep that in mind. I could say a lot of things here, really. When it comes to lifestyle, stress is going to be another big part of it, and I think working on those stress management techniques is going to be really essential for PCOS, whether you have a type where you're impacted by stress or not. Maybe you don't realize you're super stressed, but I think we can all say we all have a little bit of stress going on. And with that in mind, like, that's going to definitely be something that needs to be addressed and supported. So I would say find your people, whether that is in your healthcare team, find those people that are going to advocate for you, advocate for yourself, and then also work on those basic lifestyle factors that are going to make a long-term difference, especially if you don't have access to someone like myself who can really guide you a bit more deeper.
You say build yourself a team, and I know earlier you said you work with medical doctors, pelvic floor physios. So if I was starting out, who would I call first? Who are the people on my team that you're referring to?
Totally. So definitely having a gynecologist or an MD or a nurse practitioner. I know right now people are struggling in Ontario and in BC, really across the board, to get medical doctors, but having someone there that can support you on that realm. At the end of the day, I'm limited in my scope. I can't send you for an ultrasound. I can't do certain medical treatments. So in that, we have to collaborate. The second part would be a naturopathic doctor, someone who can be well versed in those various aspects that are impacting PCOS, not just looking at a pill, but rather looking at your diet, your sleep, your gut health, all of the things that are impacting your health, and be able to treat that. Nutritionists are also somewhat people that would be really impactful. We work with a nutritionist close on my team at the Clara Clinic, and so that's something that's really important, is just being able to have someone guide you. I think there's so much nutrition information. There's a lot of guilt around food. There's a lot of confusion with it. So I think that's another piece as well. And then pelvic floor physiotherapy can be important for some folks who are dealing with vaginal dryness or dealing with low libido, those types of things, because of pelvic pain that could be associated with other conditions. So I think it's just really, what are you going through? And then let's branch out to these different team members that can help support you.
And you mentioned earlier about the word curable when it comes to PCOS. That's a question I hear often on socials. Is PCOS curable?
Yeah, so it's actually not. It's something that would need to be maintained long term. But if we start treating, let's say someone comes into my office and they have severe insulin resistance or severe inflammation, or we're dealing with, you know, really high stress, and we start managing that, they could see that their symptoms maybe never come back. There's also people that manage it for years and they have a significant stressor in their life and they flare. So I think it's something that needs to be always addressed, managed, and then maintained in terms of treatment long term. So whether that's yearly check-ins with your doctor, naturopathic doctor, whatever that looks like for you, but it needs to be checked in on. It's not something that is a one and done type of treatment approach.
You just have to be able to learn how to manage it and create that tools that you can always reach for in case there is a flare up.
Yeah, and figure out what's working for you. Like for me, I'll speak firsthand. I'm a stress-based PCOS. If I'm not stressed, my period's are regular, everything's fine, my symptoms look good. And then if I have a stressor, like anytime I was writing exams back at my naturopathic college, my period was late. It was like clockwork every time. And so it's about finding those things that are the triggers or those things that make things worse, being able to find strategies and people to help support you through that.
I feel like the stress-related aspect is the story that I hear most often. So for example, if there is someone, like what you said in your case, during exams when you were a student, it seemed to happen. And then let's say after graduation, maybe you haven't been in that exact severeness of stress and you haven't been feeling those symptoms. Does that mean the PCOS is gone, or was it just a fluke, or is it?
Yeah, so it's not necessarily that the PCOS, and this is where it gets confusing because people can jump in and out of the criteria because there's only 2 out of 3.
So you said 2 out of 3, so sometimes you can be in 1, sometimes 3, then you can go back. Okay.
So people can kind of jump in and out. The reality is that if you've been diagnosed with it, it's something that you should be monitoring long term because there are long term impacts. So for me, when things are cleared, it's great, but I know deep down I can be triggered by certain things. And so it's just having that understanding that you do have this condition. These are the things that you can do if things get flared. And these are the things that you should be doing on a regular basis. The sleep, the dietary pieces, the movement. Those are the things that you should be doing on a regular basis to maintain the changes.
Okay, that's good to know. I did not know it could be an in and out process depending what your triggers are and the root cause as well.
Totally.
I know you touched a bit on fertility, and there is this narrative that you can't get pregnant when you have PCOS. Could you explain a little bit more that? Is that true? Is that false?
Yeah, definitely false. I've had patients who, and fertility is already such a challenging journey. Some people don't know if they want to conceive, but being told that you can't is a different conversation. Right? And so I have had patients walk in and say, you know, my doctors told me that I'm never going to be able to have a child. And it's so far from the truth. I have patients who have both endometriosis and PCOS having children. So it's just about really getting into the know of what your condition is and what we need to do to treat it. So 9 times out of 10, there's not going to be a big issue. There might be certain things we need to do. So for example, let's go back to the basics of PCOS. Some people don't ovulate. So we need to get a regular cycle for you to be able to release an egg. For some people, they might not have enough progesterone. So maybe we're doing some supplementation or we're prescribing progesterone. That might be effective in those cases. It really depends, again, going back to what are your symptoms, what are your tests showing, what are those things that are causing the fertility issues, treat that. we've seen great success. So I don't feel discouraged by these very blanket statements saying that you are not going to be able to conceive. Know that there's hope and there's people that have been able to do it.
I'm sure that's going to bring a lot of comfort to people listening.
I hope.
And I really appreciate you being honest and giving these science-backed facts when it comes to breaking down these myths with PCOS, because like you said, it's such a commonly thrown around word on social, so it's spaces like this where we can really debunk
100%.
these things.
Yeah.
So I have two questions that came up. One, you mentioned low inflammatory foods.
Yes.
I'd love to hear of examples that people can maybe start adding into their diet.
Totally. So I actually am a naturopathic doctor who doesn't love restriction.
Okay.
I think there's too much of it. You know, everyone needs to cut out gluten. Everyone needs to cut out dairy. It's really person to person.
Yeah.
I think just focusing on the basics. I think I will talk about the anti-inflammatory piece in a second, but protein, no one is eating enough protein. Okay, so everyone just focus on getting protein up is a big part.
Yeah.
It can help with insulin resistance, it can help with inflammation, but also your energy. I've seen significant improvements in like 2 weeks with patients who they started upping their protein and their energy and mood significantly changed.
And how much is good enough protein?
Depends on your body weight.
Okay.
What I usually start at is like minimum of 20 grams of protein per meal. It's like a minimum. Let's start there. Let's work towards that, because some people are maybe getting 1 or 2 eggs in the morning, and that's about 12 grams. So it's like, it's still something that we want to set a realistic goal on. So protein being a big part. Healthy fats, that's another part of an anti-inflammatory diet. So looking at things like olive oil, avocados, nuts, seeds, nut butters, fish, eggs, those types of things. And then just avoiding really processed foods, like processed sugars, processed meats, those types of things can be really aggravating for PCOS symptoms in general, but just in general health. When we look at diabetes and things like that, that can also be a bit problematic. PCOS generally, when I keep saying insulin resistance, I will take that message home, because it is definitely one of those things where it's showing up in every, 99% of my patients, I would say, have some level of insulin resistance or issues with their blood sugar. And so looking at the types of carbohydrates that you're eating, not cutting carbs necessarily for all people, but rather maybe you're having more fiber, maybe you're having more complex carbs, maybe you're going for walks after meals. There's different ways that we can regulate our blood sugar, even if we're consuming carbs. Like, it's okay, carbs aren't a bad thing. It's not something that everyone needs to reduce, but it's ways that we can modify how our body is responding to those sugars.
Yeah. I like how a lot of things you're saying are things we can do for free.
Yeah.
It's free medicine.
Yep.
Just changing our diet can have a huge impact.
Huge impact.
There was also another thing that you mentioned that brought my attention. It was the myth around high intensity interval training.
Yes.
How that connects to PCOS. Can you talk a little bit more about that?
Yeah, I think there's this myth that high intensity interval training is very bad for hormones. It wasn't even just PCOS, it's just this idea that it's super bad for hormones.
Yeah.
I think there is caveats to all statements. The biggest one here is that the research does not show that, especially in most PCOS folks. They are thriving off of higher intensity training.
Okay.
The problem is when we go too far. So if I have patients who are working out like for 2 hours, or they're doing really high intensity interval training and they're not letting themselves breathe, and then after the workout they're feeling really drained, that's a sign to me that we need to shift the workouts. But it's not to label all high intensity interval training as a bad thing. I think that's where we get it wrong. We get it wrong by labeling things as bad when it's really dependent on the person in front of you. And you need to know what's working for your body. If you feel really good after high intensity interval training, great, right? If you're not feeling good after a long run, then maybe we need to shorten the run or do it in shorter bursts, right? So it's just about modifying it to how you feel. And then of course, if we see on hormones, let's say I have a patient who's coming in and they're very, very lean. They're doing really, really long runs, working out every day for hours and hours. That could impact the ability for your body to say, we need to menstruate, we need to cycle. It actually could shut that system down. That's where we might need to be a bit more conscientious, but overall, HIIT can be great. Weight training can be great. Running can be great. We need to find movement that we love and stop kind of shaming things for being bad when it's not the exercise itself, it's just the person that needs to choose something that's working for them.
So learning how to listen to your body, be intuitive, be curious, ask those questions, and have a support system like a naturopath to come support you and relay back information whether or not what you're feeling is a reason to change something in your diet or lifestyle, or maybe what you're doing is perfectly fine.
Yeah, totally. And I think it's just being mindful of the content that you're consuming, right? Like if people are saying these blanket statements like, you need to cut out all gluten and dairy in order to cure your PCOS. First of all, like we said, you cannot cure PCOS. And then these blanket statements can also be a bit challenging as well. And then the other piece is just if we are dealing with folks who are coming in and they run on TikTok, in 3 weeks I can cure my insulin resistance. This is real. I saw this on TikTok.
Really?
Yeah. This is something that you need to be mindful of in terms of the information that's out there, and just having realistic expectations and talking to people who are have some expertise in this area for sure.
Okay. All right, so for rapid fire, I'm just going to list off a few statements and you just ping to me whether they're true or they're false.
Okay.
All right, so first one, PCOS only affects the ovaries.
False.
PCOS can impact your fertility.
True. But caveat.
Yes.
Caveat there.
PCOS means you have cysts on your ovaries.
False, not always.
PCOS symptoms usually improve with weight gain.
False.
PCOS is a rare condition.
False.
PCOS symptoms usually start after menopause.
False.
Those with PCOS are at higher risk of developing type 2 diabetes.
True.
Want to talk a little bit more about that?
Yeah, so the conditions related to PCOS, like I said, because the root causes are so associated with so many other things. Type 2 diabetes comes up. Yeah, we see the fertility challenges, not with everyone, but definitely there. We do see issues with heart disease as well, and just those chronic diseases that can come up. And then the mood changes, anxiety, and depression. I think the big thing with type 2 diabetes is we can catch it early. Signs of insulin resistance show up way before HbA1c and diagnostic criteria for diabetes even shows up, so we can look at those much earlier on and prevent those things 100%. It's not a blanket statement that everyone's going to get type 2 diabetes. It's just a risk factor.
And how can we check our insulin levels? Because I know we always go back to that.
Oh my gosh, yeah, that's what we should have tested. That's what we should have talked about. So insulin, there's kind of two main tests that our system runs. I will say majority of the time, this is not part of your annual screening. I think it should be, and I'm hoping in the next few years this starts to change. But what it would typically be is either one, we can do something called the HOMA-IR, where they check your fasting glucose, your fasting blood sugar, and your fasting insulin. They compare those numbers, and anything over 1.9 is considered insulin resistance. We could take that a step further, and I actually did this test a few weeks ago, so I could speak from firsthand. It is a 2-hour test. It is not fun, but it gives us a lot more information. And so what you would do, you go in the lab, they do the same fasting test, so they're fasting insulin and glucose. Then they'll give you a sugary drink. It has 75 grams of sugar. And then they'll test your blood sugar and insulin at the 30-minute mark after the drink, the 1-hour mark, and the 2-hour mark. And it basically gives us a lot more information on how your body is actually responding to the sugar. Some people go into a state where they produce way too much insulin. Some people just don't respond to the insulin. Some people don't go into a state of hypoglycemia and they get blood sugar issues. So it really just depends on the person. It gives us way more information. And it's usually a test that you should probably ask your naturopathic doctor for, because typically it's not run through our OHIP system.
Okay, and then how much would it cost for either test?
Yeah, so at the clinic, usually it's around $30 to get.
That's really accessible.
Yeah, super accessible. To get insulin checked, especially because a lot of the other things your doctors might be willing to run, like your iron and your CBCs and all of those things. These are just one areas that I see time and time again come up as a bit of resistance.
It's good to know. It's always handy to get it checked maybe once a year.
Yeah, totally. Yeah, I would love if that was part of our OHIP, like annual checkups with their doctors, insulin. That would be great.
Well, thank you so much for coming on.
Thank you so much
and we appreciate answering all these questions. I'm sure you brought a lot of hope and education to a lot of our listeners. So if anyone wants to work with you, we'll put your socials down below and they can connect with you.
Awesome. Yeah, that'd be great.
All right. Well, thanks everyone for listening. See you.